Hello, my name is Christopher Anselmi. I'm one of the chiropractors here at the Center for Spine Care Mobility. Recently, we've had an uptick in patients coming in with posture-related neck and upper back pain. So what we're talking about is patients with pain in the neck, shoulders, mid-back region. And the reason why we're seeing this, we believe, is poor ergonomics and poor posture. So people have been spending a significant amount of time working from their home office. That either means working from their couch, working from their kitchen table, working from their bed, and because of that they develop poor ergonomic patterns. What we do is we start off with a history and exam to determine what is going on with the patient. My history consists of things like onset, what kind of pain they're experiencing, the quality of the pain, whether or not the pain radiates down into their arm or up into their neck causing headaches, the site, the specific site of the pain, whether it's bilateral or unilateral, and when it bothers them. Is it worse in the morning? Is it worse in the evening? Is it worse during the day when they're working? What is my primary diagnosis? What is going on with my neck and upper back? In this particular case here, this is something called upper cross syndrome. So we have a short, tight muscle complex which is pulling the neck forward in combination with long, weak musculature which is not holding that neck in its proper position. As a chiropractor, as a physical medicine practitioner, it is very important that I palpate the patient. I want to feel what's going on. I want to do things like ranges of motion, both active and passively. I want to check the strength of the muscles surrounding the area that we're talking about. I want to make sure that the patient's moving properly. After the examination, if we deem it necessary, we'll actually radiograph the patient. So here's an example of a radiograph of a patient who recently came into our office with neck and upper back pain. To a normal person, or to a person who's not familiar with looking at x-rays, this might look like a perfectly fine x-ray. But in actuality, what we're looking at is a neck which is shifted forward quite a bit. If you look at this little hole here, this is where your ear is supposed to be, or this is where your ear is. And your ear is supposed to line up directly over your shoulder. So if you notice, this person has shifted forward quite a bit in terms of their posture. When something like this happens, you put a significant amount of stress in the lower portion of your cervical spine. If you look up and down the spine, we see dark spots in between the vertebra. These are your disc spaces, and this is where your disc lies in between your vertebral bodies. A loss of disc space consists of pressure, or there's pressure being placed in between those two vertebrae. You'll also notice here in this spine, we have a little bit of what we call osteophyte formation, which is an increase in bone in order to compensate for this forward head carriage. So this radiograph, in conjunction with my exam and my history, allows me to create a working diagnosis for this patient. Here at the Center for Spine Care Mobility, my job as the chiropractor is to lengthen short, tight tissue and align skeletal structure. So our jobs are to stretch out muscles, tendons, and tissue which have become short and tight and not moving properly. In combination with that is we realign the spine with chiropractic manipulation. So the tools that we use are things like active release technique, Graston technique, cervical manipulation, cervical stretching, and posture-related stretches in order to gain length in short, tight tissue. We usually combine that with something like physical therapy, which helps strengthen long, weak tissue. And if we have a stubborn neck, or if we have significant issues, we can use things like trigger point therapy, acupuncture, or even deep tissue massage. So we would treat this with a combination of chiropractic services, physical therapy in order to strengthen the spine. We might put this patient in a posture brace to bring the shoulders back and down. And because this patient has had chronic pain, we incorporated some acupuncture in order to alleviate some of her pain problems. Some of the questions patients have are, how long will this process take? Here at the Center for Spine Care Mobility, we reevaluate patients every 4 weeks. So we treat them for a period of time, re-examine them at a 4-week interval to determine how they're responding to care, whether or not the service is appropriate, and what either additional services they need, or whether or not we need to reduce services. The sooner we have a chance to address some of these posture-related issues, the better the outcomes for the patient. So my suggestion is not to wait. If you have these problems, come in and let us check it out.